Hello everyone, Dr. Don here. Listen, today I want to talk to you guys about reversing diabetes in 30 days with a raw diet. Because there's been trials done before with just amazing results with literally just changing your diet in order to reverse a disease process. Now, I will tell you that this is not going to work for everybody watching this video. There is a lot of you that are watching this video that are so far down the disease process that diet alone is not enough to reverse the disease process. See, typically what we see with diabetes is most of you were diagnosed on a routine office visit. So you go to the doctor for some other health-related issue, whether you have the flu or a cold, you're getting a life insurance policy out. For whatever reason, you go to the doctor, they run some basic blood work. Now you return to that doctor for those results. The doctor sits you down. You can already tell he doesn't have anything good to say. And from what most of the patients that I've worked with over the last 10 years, what they have told me is that before this doctor even explains what diabetes is, or really even finishes telling you that you've got this horrible disease process beginning in your body, he's got his ink pen clicked, his prescription pad out, and he proceeds to write you your first oral diabetic medication. You're told to lose weight, exercise, and improve the way you eat. That's pretty much the extent of the counseling that you get day one. And as many of you know, that's pretty much the extent of the counseling that you receive throughout the disease process or throughout your lifetime. And so when you start your first medication, whether that really works to temporarily reduce those blood sugar levels, in the near future, typically what we see in the next 6 to 12, even 18 months, you return to that doctor for follow-up exams, and sure enough, that doctor's not happy with the results. Your sugars are slowly creeping up. And so what that doctor will do is they will increase your medication. Typically, you will max out that first oral medication. Now, what we see over time is that you need more and more medication, and to the point to where even needing insulin therapy or insulin injections to keep those sugars at a decent level. There's a couple reasons why the standard of care in our country, standard of care meaning this is what happens in our healthcare system, is that diabetics get worse with time. Typically, we don't see diabetics improving their health or the disease process improving over time. We see them needing more and more medication, gaining more and more weight, having less and less energy. Overall, we just see diabetics in our country living a much poorer quality of life than they should. And there's a couple reasons for that. The main reason is because the disease process itself is not being addressed by the medications that you're being prescribed. See, we can't cut you open and remove your diabetes. Diabetes is a metabolic syndrome. It's a metabolic disorder. So you've got dysfunctions within many different organ systems that led to the inability to control blood sugars. So if we look at what controls blood sugar in the body, the thyroid, the liver, the pancreas, and the adrenal glands, those are the organs and glands that have direct control over blood sugar in our body. And so the medications that you're taking, they are not designed to go into your body and normalize function. See, notice I said normalize function, because when your body is functioning normally, there is no presence of disease. There is no presence of symptoms. And so in order to normalize function in your body, we need to find out where the dysfunction is. And see, the testing that you're having done on you, the testing is only designed to track and manage the disease process. So the type of testing that I do with my patients is designed to find out where the dysfunction is. See guys, I don't treat diabetes, I don't treat irritable bowel syndrome, I don't treat metabolic syndrome and insulin resistance, I don't treat heart disease, high cholesterol, high blood pressure. Now, I see amazing results with every single one of those conditions that I mentioned, but it's only because my job is to normalize function in your body. Because just like I said a minute ago, if we can get your body back to normal function, then there is no way that you're gonna have diabetes anymore. Now, using a strictly raw diet sometimes is enough to normalize function in your body. Because see, all the types of foods that we're eating today, our bodies are not designed to process those. Not only are they not designed to process those, but those foods that we're eating every day, they're producing a ton of inflammation in our body. See, regardless of what kind of doctor you are, whether you're just a general practitioner, whether you're an endocrinologist, whether you're an oncologist, whether you're a gastroenterologist, whether you're a chiropractor or a naturopath, regardless of what kind of doctor you are, just about the only thing that we all agree on, and this has been since the 50s, is that inflammation drives every single disease process. See, the approach to addressing that inflammation is what makes the individual doctors unique. Unfortunately, your doctor's approach to treating the inflammation is to give you a drug or give you a medication to suppress the symptom of what that inflammation is causing. My approach to that inflammation is to find out why the inflammation is being produced at an abnormal rate, fix that underlying problem, and then the inflammation goes away. Without inflammation, we don't have disease. I know that makes a lot of sense to you guys. I know that sounds simple, but unfortunately, in order to get the results that I'm talking about, we need to make a change. And yes, absolutely, diet is the first place that we need to start. Now, as a diabetic, because you're not getting a lot of help from your docs, you do a lot of research. So if you type in diabetic diets on Google, you're gonna get hundreds of diets that come up, and they're all gonna contradict each other. So what most of you do is you say, the heck with it, they're all contradicting each other, I'm just gonna eat what I want, right? And so let me define what a raw diet means, okay? So a raw diet, I'm just gonna tell you what we need to eliminate in order for you to be eating a raw diet, okay? So we're gonna do absolutely no commercialized meat. We're gonna do no dairy. We're gonna do no grains. We're gonna do no alcohol, no caffeine, okay? No refined foods. There are some whole grains that are okay to do. We can talk more specifically about what those grains are. But we're gonna absolutely do no junk food, no fast food, no processed food, okay? No junk food and candy of any kind. And guys, what we've seen when you go to a strictly raw diet, with some of you out there that doesn't have too much dysfunction within your body, we can see this disease process completely reversed in as little as 30 days. Now, guys, a lot of the docs that you're seeing will tell you that diabetes is an irreversible disease process. And the reason why they tell you that, it's not because they're lying to you, it's not because they're not smart or they don't care about you. The reasons they're telling you that is because that is what they experience in their clinics every day. They experience their patients getting worse with time. They experience their patients needing more and more medications over time, gaining more and more weight, having less and less energy. Again, they just see their patients living a very, very poor quality of life. And then they see their patients reaching the complications of the disease. They see them developing peripheral neuropathies, not being able to walk properly. They see them having heart disease, open heart surgeries, going blind from retinal neuropathies, going on dialysis, right? Losing limbs from the neuropathy. Must I go on, right? So they see them going towards this direction, and then they see them dying at a young age. So their experience in their office is that this disease process is irreversible. And with symptom suppressing drugs, with that approach, that is exactly correct. You will never reverse this disease process. So the definition of insanity is doing the same thing over and over and expecting a different result. In order for you to reverse your disease process, in order for you to get your life back, in order for you to be able to enjoy your grandkids, your kids, go on vacation, enjoy your golden years, you have to make a change. And like I said before, changing your diet is the first place to start. And for many of you, just by following this raw diet, you can get off your insulin injections, you can get off your oral medications, you can normalize your blood sugars, you can certainly lose weight, increase your energy levels, and truly be healthy at a cellular level. But like I said, there's many of you watching this video by just removing the meat, the dairy, the sugars, the grains, right? Just by removing all these toxins and chemicals that are in all these processed foods, you're gonna see an improvement, no doubt. You're gonna feel better, no doubt. You're gonna lose some weight, but you're gonna hit a plateau. You're gonna only get so far. And then what we see in these instances is you end up giving up. And so the main reason I'm shooting this video is to tell you that yes, a raw diet, we could see amazing results with your overall health. But most importantly, don't give up. If you get 30, 60 days into a raw diet and you see that you're plateauing and your sugars are only getting down to 150, your A1C is only getting down to 7.5, and you just can't break that barrier, it's because you have so much metabolic dysfunction in your body that those issues must be addressed.